There are some pregnancies that will not survive except the cervix is stitched. Except they use something to hold the cervix, that pregnancy will not stay. Now, this condition is called cervical incompetence. There are some women that are either born with short cervix or very weak cervix, to the extent that if they get pregnant before 12 weeks of pregnancy, baby will just go out. Now, what is the solution? The solution is when you discover that shortness of the cervix or weakness of the cervix is the cause, you have to go for a procedure called cervical cerclage, where they will have to stitch the cervix in place before 12 weeks or around 12 weeks of pregnancy. Then around 36 weeks of pregnancy, they will loosen the stitch for spontaneous labor to occur. I have seen a lot of women that have had series of miscarriages because they are not aware that the cause of the miscarriage is the weakness of their cervix. Mamas, if you have been having 1 or 2 miscarriages, or you know someone that have been having recurrent miscarriages without even knowing, let her go for cervical examination to know if the cervix is the cause of the miscarriage. Now, another question that you will ask is, what about mercury? Can a woman that did cervical cerclage do mercury? Ideally, your doctor will tell you after 2 months. By that time, they are sure that the cervix is now in place. You can now do mercury. But my sister, if I should advise you, I will say, since you know that the pregnancy is already stressing you, after the procedure, after the cervical cerclage, no need to do mercury. Avoid it, just for the safety of the pregnancy. Then after you give birth to your baby, you can now continue. This is my advice to you. If you know anybody that needs this information, please share this video to that person, because I know it's going to save some people a lot of stress. I'm not Stella, always at your cervix.